So what is frozen shoulder? You hear this term frozen shoulder from your doctor. What you know is that it hurts. I'm here to tell you the mechanics behind it, because sometimes that knowledge is giving you the power to get through it. Frozen shoulder can start out of nowhere. It can go away just as easily, but it usually takes up to a year to disappear. It can also start over long term. So this is what your shoulder looks like. This is your arm bone, this is your shoulder bone, and this is the collarbone that goes across. They join together here, what's called the acromioclavicular joint. Your arm moves in that space like this. The problem comes because there's 4 tendons that go through this little space. They get pinched if this arm bone doesn't move correctly in here. This whole thing is encapsulated in what we call a capsule. So when frozen shoulder occurs, that capsule has shrunk. It's shrunk and it won't allow this to move because it's a really strong fibrous capsule. It's strong enough to let you lift things with this arm without letting the arm pull out of the socket. So there's a couple of things that can be very, very helpful in managing frozen shoulder. And the first one is heat. A little bit of warm heat, deep penetrating heat, before you try any stretching exercises. In physical therapy, what we suggest is for people to stand in a shower, let hot water hit that shoulder, and then try to gently walk their arms up the wall of the shoulder forward, walk the arms up the shoulder to the side. So frozen shoulder can also be helped by anti-inflammatories. Anti-inflammatories are something that you want to check with your doctor, even if it's over the counter. They may interact with other things you're taking, but it's an anti-inflammatory medication. The last thing I like to suggest to people with frozen shoulder is to use ice after exercise, after they've been driving or typing or doing anything that they think might have irritated. Because remember, you have a very small space between this bone and this one. There are 4 tendons that go through those. If they're irritated by activity at all, they swell. And then as I tell my patients, you have 10 pounds of crap in a 5-pound bag. It just doesn't fit. I have some other videos that I'll link to this one that can show you more about the exercises, both stretching and strengthening, to help manage frozen shoulder. But again, it's important to know what frozen shoulder is. If you like this video and you want to see more, just click the subscribe button below. If you hit the bell, you'll get notified anytime I post more content. Thanks. It's Bill, your body guru.